Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. While caring for a patient in the post-anesthesia care unit, PACU, who has developed hypovolemic shock, a nurse should position the patient flat with legs elevated, B. in Trendelenburg position, C. with the head of the bed elevated 45 degrees, D. completely flat. The answer is option A, flat with legs elevated. 2. A 5-year-old child girl had presented with tenderness, headache and petechiae. She was pale and complains of joint pain. On palpation there was an enlarged spleen, liver and lymph nodes. A lumbar puncture showed central nervous system involvement. The child underwent chemotherapy treatment and is now attended by the nurse for regular routine examinations. Which condition would require more attention from the nurse? A. Increased leukocytes, B. Lack of muscle coordination, C. Bleeding while brushing teeth, D. Occasional nausea and vomiting. The answer is option C, bleeding while brushing teeth. 3. During the evaluation at a community clinic, the patient completes the medical history. Which of the following is not a risk factor for an acute myocardial infarction? Coronary artery disease, B. Smoking, C. Hemophilia, D. Hyperlipidemia. The answer is option C, hemophilia. 4. A postoperative patient has the nursing diagnosis of ineffective tissue perfusion. To assess for tissue perfusion, the nurse should check all of the following except skin and nail bed color, B. temperature of extremities, C. respiratory rate, D. peripheral pulses. The answer is option B, temperature of extremities. 5. A patient visits the clinic for a 2-week checkup after a corneal transplantation, keratoplasty. The nurse observes the patent sclera is red and the patient complains of the eye feeling irritated. The nurse suspects the patient may have A. infection, B. hemorrhage, C. graft rejection, D. postoperative glaucoma. The answer is option C, graft rejection. 6. The nurse is assessing a patient who just had surgery under general anesthesia. The patient's respiration rate is 4 per minute and the O2 saturation on 3 L per minute of oxygen via nasal cannula is 84%. The nurse is awaiting the results of an arterial blood gas, ABG, and anticipates that which of the following will be elevated? A. Arterial oxygen saturation, SAW2, B. Hydrogen ion concentration, pH, C. Partial pressure of arterial oxygen, PaO2, D. Partial pressure of arterial carbon dioxide, PaCO2. The answer is option D, partial pressure of arterial carbon dioxide, PaCO2. 7. During the immediate postoperative period, a patient reveals an oxygen saturation of 91%. The nurse should A. Position the patient on the left side, B. Administer supplemental oxygen, C. Continue to provide supportive care, D. Lower the temperature of the room. The answer is option B. Administer supplemental oxygen. 8. The nurse performs an assessment of a 23-year-old man who believes that people are spying on him. During the interview, he keeps his eyes to the floor and answers questions awkwardly. He has never had an intimate relationship and avoids contact with his family members. He has never been employed and tells the nurse that he is not looking for a job. The nurse considers Erikson's theory of psychosocial development. Which stage is this patient most likely experiencing? A. Autonomy versus shame and doubt. B. Initiative versus guilt. C. Trust versus mistrust. D. Identity versus confusion. The answer is option C. Trust versus mistrust. 9. A 32-year-old woman with a motor neuron disease has progressive weakness of cranial nerves V9-12. She has recently been experiencing sudden outbursts of crying and laughing. Both stroke and myasthenia gravis have been ruled out. Which voluntary muscle activity would be most significantly impacted? A. Walking. B. Swallowing. C. Breathing. D. Smelling. The answer is option B. Swallowing. 10. Causes of primary hypothyroidism in adults include A. Malignant or benign thyroid nodules. B. Surgical removal or failure of the pituitary gland. C. Surgical removal or radiation of thyroid gland. D. Autoimmune-induced atrophy of the gland. The answer is option D. Autoimmune-induced atrophy of the gland. 11. A 72-year-old patient is diagnosed with hypothyroidism, and levothyroxine, Synthroid, is prescribed during initiation of thyroid replacement for the patient. It is most important for the nurse to assess mental status, B. Nutritional level, C. Cardiac function, D. Fluid balance. The answer is option C. Cardiac function. 12. A client presents with hypocalcemia, hyperphosphatemia, muscle cramps, and positive Trousseau's sign. What diagnosis does this support? Diabetes insipidus, B. Conn syndrome, C. Hypoparathyroidism, D. Acromegaly. The answer is option C. Hypoparathyroidism. 13. The nurse acknowledges that the first-line drug for treating of client's blood pressure might be which drug? Diuretic, B. Alpha blocker, C. ACE inhibitor, D. Alpha/beta blocker. The answer is option A. Diuretic. 14. The nurse is teaching a client about clopidogrel, Plavix. What is important information to include? A. Constipation may occur. B. Hypotension may occur. C. Bleeding may increase when taken with aspirin. D. Normal dose is 25 mg tablet per day. The answer is option C. Bleeding may increase when taken with aspirin. 15. The nurse knows that the client's cholesterol level should be within which range? A. 150 to 200 mg per deciliter. B. 200 to 225 mg per deciliter. C. 225 to 250 mg per deciliter. D. Greater than 250 mg per deciliter. The answer is option A, 150 to 200 mg per deciliter. 16. The nurse is performing an assessment in a client with a suspected diagnosis of cataract. The chief clinical manifestation that the nurse would expect to note in the early stages of cataract formation is A. Eye pain, B. Floating spots, C. Blurred vision, D. Diplopia. The answer is option C, blurred vision. 17. A client who has a history of Crohn's disease is admitted to the hospital with fever, diarrhea, cramping, abdominal pain, and weight loss. The nurse should monitor the client for hyperalbuminemia, B. Thrombocytopenia, C. Hypokalemia, D. Hypercalcemia. The answer is option C, hypokalemia. 18. Adult patient complains of diarrhea, vomiting, abdomen cramp and pain within the past 2 weeks. The patient reported that the pain increases when he eats and relieves when he passes stool. Which of the following may be the cause? A. Appendicitis, B. Crohn's disease, C. Ectopic pregnant, D. cholecystitis. The answer is option B, Crohn's disease. 19. When caring for a 3-day-old neonate who is receiving phototherapy to treat jaundice, the nurse in charge would expect to do which of the following? Turn the neonate every 6 hours, B. Encourage the mother to discontinue breastfeeding, C. Notify the physician if the skin becomes bronze in color, D. Check the vital signs every 2 to 4 hours. The answer is option D. Check the vital signs every 2 to 4 hours. 20. After 3 days of breastfeeding, a postpartum patient reports nipple soreness. To relieve her discomfort, the nurse should suggest that she A. Apply warm compresses to her nipples just before feedings, B. Lubricate her nipples with expressed milk before feeding, C. Dry her nipples with a soft towel after feedings, D. Apply soap directly to her nipples, and then rinse. The answer is option B. Lubricate her nipples with expressed milk before feeding. 21. Which of the following interventions would be helpful to a breastfeeding mother who is experiencing engorged breasts? A. Applying ice, B. Applying a breast binder, C. Teaching how to express her breasts in a warm shower, D. Administering bromocriptine, Perladel. The answer is option C. Teaching how to express her breasts in a warm shower. 22. What type of milk is present in the breast 7 to 10 days postpartum? A. Colostrum, B. Hind milk, C. Mature milk, D. Transitional milk. The answer is option D, transitional milk. 23. Which of the following is a sign of rejection after a renal transplantation operation? Decreased potassium, B. Decreased sodium, C. Decreased creatinine, D. Decreased urine output. The answer is option D, decreased urine output. 24. Which of the following is among the signs of magnesium toxicity? Cardiac arrhythmia, B. Loss of deep tendon reflex, C. Patient confusion and irritability, D. Respiratory failure. The answer is option B, loss of deep tendon reflex. 25. A nurse is caring for a client who has a potassium level of 5.4 milliequivalent/L. The nurse should assess the client for ECG changes, B. Constipation, C. Polyuria, D. Hypotension. The answer is option A, ECG changes. 26. Moderate to severe hypokalemia in a patient will cause the nurse to observe A. Muscle spasms and slow respirations, B. Muscle weakness and cardiac dysrhythmias, C. Confusion and irritability, D. Vomiting and diarrhea. The answer is option B, muscle weakness and cardiac dysrhythmias. 27. Which of the following electrolytes decrease would cause PVC, premature ventricular contraction? F. Potassium, B. Sodium, C. Calcium, D. Magnesium. The answer is option A, potassium. 28. Which of the following electrolytes decrease would cause recurrent vomiting and general weakness? A. Potassium, B. Sodium, C. Calcium, D. Magnesium. The answer is option A, potassium. 29. The nurse is educating a couple who has had difficulty with conception. The client asks about the hormone, which is responsible for the production of eggs. The nurse answers that this hormone is called A. Melanocyte-stimulating hormone, B. Luteinizing hormone, LH, C. Follicle-stimulating hormone, FSH, D. Interstitial cell-stimulating hormone, ICSH. The answer is option C, follicle-stimulating hormone, FSH. 30. The patient has an order to receive 45 mg of prednisone by mouth daily. Available are 10 mg tablets. How many tablets should the nurse prepare to give? A. 1.6, B. 2, C. 4.5, D. 6. The answer is option C, 4.5. 31. The nurse caring for a 54-year-old patient hospitalized with diabetes mellitus would look for which of the following laboratory test results to obtain information on the patient's past glucose control, A. Prealbumin level, B. Urine ketone level, C. Fasting glucose level, D. Glycosylated hemoglobin level. The answer is option D, glycosylated hemoglobin level. 32. Which laboratory test is most important for the nurse to monitor to determine how effectively the client's diabetes is being managed? A. Fasting blood glucose. B. Blood chemistry profile. C. Complete blood count. D. Glycosylated hemoglobin, HbA1c. The answer is option D, glycosylated hemoglobin, HbA1c. 33. Blood sugar for new employee at company with sedentary lifestyle and obese and by result of fasting blood sugar 6.9 mole, abnormal reading. What is the best next step to do to estimate his blood sugar condition? A. Draw a blood sample for HbA1c. B. Repeat the test for the next 2 days. C. Estimate the postprandial sugar level. D. Write a recommendation note for not hiring him. The answer is option A, draw a blood sample for HbA1c. 34. HbA1c as a measurement instrument for glucose level in the blood. It measures blood glucose level within last 3 months, B. last 5 months, C. last 7 months, D. last 1 year. The answer is option A, last 3 months. 35. Which laboratory test indicates liver cirrhosis? A. Decreased red blood cell count. B. Decreased serum acid phosphatase level. C. Elevated white blood cell count. D. Elevated serum aminotransferase. The answer is option D, elevated serum aminotransferase. 36. Which statement best describes the difference between the pain of angina and the pain of myocardial infarction? The pain associated with angina is relieved by rest. B. Pain associated with myocardial infarction is always more severe. C. Pain associated with angina is confined to the chest area. D. Pain associated with myocardial infarction is referred to the left arm. The answer is option A. Pain associated with angina is relieved by rest. 37. The nurse is developing a bowel retraining plan for a client with multiple sclerosis. Which measure is likely to be least helpful to the client? Limiting fluid intake to 1,000 milliliters per day. B. Providing a high roughage diet. C. Elevating the toilet seat for easy access. D. Establishing a regular schedule for toileting. The answer is option A, limiting fluid intake to 1,000 milliliters per day. 38. Which organism is responsible for the onset of rheumatic fever? Staphylococcus aureus. B. Listeriosis. C. Group A beta hemolytic streptococcus. D. Epstein-Barr virus. The answer is option C, Group A beta hemolytic streptococcus. 39. For what reason are patients instructed to do Kegel exercises when they are discharged after childbirth? A. They help her get back in shape. B. They prevent her breasts from becoming engorged. C. They help strengthen the perineal muscles. D. They help reduce strain on the back. The answer is option C. They help strengthen the perineal muscles. 40. You are preparing to discharge a patient who suffered third-degree burn. Which of the following instructions is appropriate to give the patient to decrease infection? You must take large amount of fluids. B. You should wash your hands thoroughly. C. You better increase vitamin intake. D. You should avoid fatty meals. The answer is option B. You should wash your hands thoroughly.
Thank you for watching.